pushing it out here. Awesome. Excellent position. Okay. Lovely. Okay. I think we're ready to go. All right, let's get TikTok live. Okie dokie. Perfect. All right, guys, I'm going to be doing a Q&A. Those of you that are on YouTube, those of you on TikTok, I will be starting very, very shortly. I'm going to be talking today about injury healing and how your rehab actually gets your lower back pain better. And of course, if you guys have any questions as we're going through this on the live, then you can always post those in the comments. I've got you guys on TikTok over here. I've got the YouTube up over here as well. So please do throw those comments into the comment section, any questions you've got. So what I wanted to kick off today, because it's something that's very poorly understood, is how your rehab actually helps you heal from these injuries down in your lower back. And before I've even started, we've got a question from Dylan. Should you fight through the pain when doing exercises? I think that's a very good place to start. So we'll come back to the topic of conversation today, because that's a very good question from Dylan there. So when you are recovering from lower back pain, you should not be fighting through, just turn the volume down there a little bit. You should not be fighting through the pain that you're experiencing when you're doing exercises, depending on what exercise you're doing, right? The first prerequisite is that you are actually doing the correct sort of exercises for your lower back pain. And we would classify those as spine stability exercises. Those like the core five, so the dead bugs, the marching bridges, the squats, the hip hinges, the step ups. These are all exercises where, if done correctly, this does not move at all. And it is the movement of this section of the spine that strains the tissues that are injured, right? And so if you're doing them correctly, then you will not get pain. However, when you're learning them, it is very reasonable to suggest that you might well not be getting them right straight out the gate. You might be bending or twisting the spine in one way or another. A simple example could be something as simple as the hip flexor stretch. When people are doing a hip flexor stretch, like so, they get into the hip flexor position and they start arching their back. And so they get that shooting pain down into the leg. That is not something to push through. So you always, when you're doing the right sort of exercises, understand that there is often going to be a little bit of a learning curve. So you're going to have to make sure you're technically doing them correctly, and you use the pain as a guiding light to say, oh, I did that wrong, I did that wrong, I did that wrong. And you combine that with videos so you can see precisely what you're doing, as well as how it's feeling, and maybe a mirror if you can as well, to understand that you're doing the exercise correctly. And then we should not be pushing through the exercises. Pushing through pain when we're doing our rehabilitation exercises. We should always be aiming for aggravation-free reps with correct choreography when we're doing these exercises. So if we're doing, for example, a squat, this is where it can catch some of you out if you're trying to recover from back pain, because many people find exercises like the knee hugs and the child's pose to actually be helpful. I'll just turn the camera around here a little bit so you guys can see me a bit better. They find exercises like the knee hugs and the child's pose to be helpful. And the reason they find these to be helpful is because they end up rounding the lower back and creating more space, which is a problem for the underlying injury. But you can imagine, if I do a squat and I just round my back like so, that might not actually be painful when I'm doing it with body weight, because I find knee hugs relieving as well. But that is not correct choreography. So we've always got the aggravation-free and we've got the correct choreography blended together to make sure that we're not making errors. Now, the reason why, just for those of you that don't know, the reason why the forward bending feels nice, and so many people get caught in this trap, is as you bend forwards, you open up the spaces here where the nerves come out. And that creates more room. It creates that temporary amount of relief while we're doing it. But it comes at a cost. You're squashing down more on the front of the vertebra here, and that's creating more strain on these ligaments that are trying to heal and tighten back up. So you want to make sure you're avoiding that kind of stuff. A couple more comments coming in. Guys, if those of you on TikTok and or on YouTube, if you've got any questions or comments, you can post those down in the chat, and I'll go through those in a second. I've got a number more on TikTok, so we'll come back to those in one moment. Just posting here in the chat here. So following on from that, so we've got Dylan's question there. We've got a couple more coming. I struggle to bend forwards. I manage everything else. The reason you struggle to bend forwards is because you don't have resilience, Jody, in the lumbar spine. And so when you bend forwards, you maximally strain the tissues on the back here that are trying to knit back together and heal. So you need to focus on learning how to perform the hip hinge so that you are bending correctly and going through the correct movement so that you're not unnecessarily aggravating the lower back. And it's a classic error, right? So many people, when they try and do the hip hinge for the first time, they look, instead of doing a hip hinge like so, right, the bum's going backwards, I'm kind of collapsing down on myself in this sort of direction. They go like this, and they lead as if they're diving into a swimming pool. And that's just putting that lower back under unnecessary strain. You're not doing it correctly. We have to do the movement correctly. Otherwise, we are going to find that it just aggravates and irritates us. What would you recommend for IT band syndrome? I think you need to have a look, Sahib, at the causes of that. Are we suggesting that IT band syndrome is associated with a lower back issue? That would make sense. The segments in the lower lumbar spine, most commonly injured L4-5 and L5-S1, they control the muscles of the hip girdles, and that could include the muscle called TFL, tensor fascia lata, which could be dysfunctional and therefore pulling on that IT band. And we're going from now till kingdom come, constantly trying to hammer into that IT band because it's tight, it's sore, it's stiff, and actually not realizing that it's a lower back issue that is sending signals to muscles telling them to tighten up. And the more we hammer that IT band, the more we're not actually dealing with the problem. So that could be it. It could also be that you've strained the IT band, but often, more minor strains to those specific tissues will recover relatively quickly. Katie, L4-S1 has me all jammed up. So that's L4-2-S1. Understand that the vast majority of you guys with lower back pain and or sciatica are going to have injuries at the level of L4-5 and L5-S1. That is these last two sections down here in the lower lumbar spine. The one between L4 and L5 and L5 and S1. These junctional areas are the areas that respond for like 90% of lower back injuries. 90% of your sciatica is coming from those sections, probably a little bit more, I would say. Cases, I've ruptured both of the discs in my lower spine. You've got to get working on the rehabilitation. And don't worry about getting them confused. Like, don't worry, it's perfectly reasonable. You're in the right ballpark anyway, Katie. It's fine. Amber Michelle said, I had lower lumbar back surgery. I'm assuming the 7th of January, or it could have been the 1st of July. I still have 2 hard knots located next to the scar. If you're worried about any kind of post-surgical stuff going on in your lower back, you always want to reach back out to the surgical team, especially if it was maybe just a month ago or so. Reach back out to them, ask them first. It's not unreasonable for a bit of time to take a bit of time for the scar tissue to remodel, especially if we've had more invasive work. Amber said it was in July, so yeah, a month ago. Always, you're relatively close to the sort of post-surgical window, let's say. Always reach out back to that surgical team. It might well be just something that's going to slowly remodel itself over time. So just bear that in mind and reach out to them. Is it possible to have a herniated and bulging disc with no sciatica? Yes, it is perfectly possible for you to have a bulging disc without sciatica. Many people will have a bulging disc and they might just have lower back pain. They might just have buttock pain. They might just have a bit of tingling in that big toe. It really does vary. And there are so many, like you'll see guys on the comments, those of you that stick around for the whole life, you'll see so many people posting in the comments, especially on TikTok if you're on YouTube right now. So many of you guys will see all different manner of symptoms associated with exactly the same injury. And it's why it's so confusing if you're constantly chasing symptoms for your lower back rather than actually targeting the root cause of the problem. That's what we should really be targeting. And then it becomes so much more simple. Get the back to heal. Help the back heal. Help getting out of the way of the back healing. And that's where we're going to get some success. Katie said, I lost 75 pounds and feel amazing. That's awesome. You've got to make sure that you are doing the rehabilitation work. So it's all well and good we're losing weight, fantastic. We've got to make sure we're rebuilding resilience at the same time or simultaneously. Does exercise cause pain in the back and leg? Can anything cause pain in the back and the leg? You can injure your back doing any manner of things. And so you ask yourself the question, did I injure myself doing some kind of exercise? And the answer there might well be yes in your particular case, Dark Demon King. Who else have we got here coming in on the comments? My lower back is so weak, Katie. Yeah, it makes sense. You've got to start doing strengthening work. We say, I've been doing stretches and heat all week, starting to break up now. You've got to get into the strengthening stuff. Obviously, that has to be done conservatively. Obviously, that has to be done with a degree of care as we're progressing forwards, considering what's happened about a month ago with regards to the surgery. But steadily starting to approach exercises like the squats and the hip hinges and having that realization in that post-surgical period that you are actually doing a squat every day. You're getting out of the bed, you're getting off the toilet, so you're doing many, many things every day that are reminiscent or or that the squat and hip hinge are emblematic of, and putting risk through this lower back, if we start to learn to move in those sort of coordinated manners more effectively, perform the squat more effectively, not round the lower back terribly, then we're going to do an awful lot better and start to really build a good, solid recovery post-operation. A back extension is useful for strengthening the lower back. I'm going to assume that this is talking about the back extension machine, and I'll spend a little bit of time to try and help you guys understand this a little bit more. So you'll see a lot of stuff online talking about the back extension machine, which is the Roman chair where you're kind of locked into a bench and you do back extensions on that. First and foremost, with this particular exercise, if done, I would argue correctly, it is a hip hinge, right? We're hinging at the hips and going through that motion, that range of motion on this particular piece of machinery. Can that be great for strengthening the spine? Well, yes, it's a hip hinge, right? It's a hip hinge. It's perfectly reasonable to do something like that if we're trying to rebuild back strength, because the hip hinge is a good exercise. And some people take it a little step further and start doing rounding the lower back stuff. Now, unless you guys have a specific question on it, I won't go into that here, but I'm more than happy to because it's a relevant topic. My biggest gripe with using the back extension machine is the following. The back extension machine is a hip hinge. The reason that we are doing exercises like the squats and hip hinges, our rehabilitation needs to actually have been thought about. Our rehabilitation needs to be as helpful as possible to the individual, every individual, so they can start at any point. They don't need to be struggling with lower back pain and a raging herniated disc with sciatica down the leg and go, now I've got to go online on Amazon or go online to some special website and spend 100 quid, 50 quid, whatever it is, to order this complex piece of machinery that I've got to assemble in my own home. Or I need to find out which gym has the bit of a gear to do it, to do exactly the same thing I can do right away. Everybody can start a hip hinge on day one with a chair in front of them for support and just go like so. That might be all you can do. That's perfectly reasonable. Some people can go lower. Some people can do a hip hinge with 6 kilos, like so. Some people can do a hip hinge with more. The idea is that you would build and progress over time. But the utilization of that back extension machine is just adding unnecessary layers of complexity to the rehabilitation process, unnecessary barriers to you getting better, to you starting to do the right sort of exercises. And so it's just, I think it's just an unnecessary layer of complexity. If I'm partway through doing my exercise, doing my squat, doing my hip hinge, or doing my back extension machine, and if I'm locked into the back extension machine like so, yeah, it's got handles on the side, right? But if I fail partway through the rep, and I'm like, oh gosh, that hurt, I moved a bit funny. You can drop your weight, yes, but now I'm stuck in a machine. My back's killing me, and I have to kind of orientate myself to get out. Whereas if you're doing a hip hinge, okay, and you're using a little bit of weight, if your back goes funny, you just drop it and step away. There's no extra layer of complexity. If you're using a barbell, you just drop it and step away. There's this unnecessary need to be unique and to have this quirky little bit of machinery that only interferes with the ability for everybody to access proper rehabilitation work. So while there are many people that will get lots of benefit from using a back extension machine, I think it's an unnecessary layer of complexity that isn't required, that only adds to an element of risk. That's not to say it can't be used really well. If you've got one in the house and you're finding you're getting on with it, crack on, right? But it becomes more and more difficult to start to build and progress your rehabilitation as you start to have to use heavier weights. It's much easier to progress on to using a barbell, which is a little bit out of shot for you guys on TikTok. But it's much, much more effective to progress on to using a barbell that you can sensibly get off the rack rather than having to mess around with these things. So I think the back extension machines are a bit more of a gimmick than anything else. That's not to say that many people can't get really good results with them, because they are essentially a back extension machine. It's just like you're adding unnecessary layers of complexity to it, and I think it's a waste of time. What else have we got? There's enough barriers, enough variables for people with lower back pain to think about when they're trying to recover. You don't need to add unnecessary extra bits. What have we got here? 3 partial spinal injuries a year ago, surgery removed meningioma, and have very stiff and numb mornings. Just on the comment about the mornings, a lot of you guys, if you've got an injury to your lower back, you're going to have inflammation in these little holes where the nerves come out, right? And those little holes can fill up with inflammation, and that can irritate the nerves. And the way in which that inflammation gets drained during the day is little bits of movement through the spine, keeping this thing a little bit mobile as you're walking around, prevent accumulation in these little holes here. And so if we stop doing that, like when we're sleeping overnight, then we're going to struggle to to tolerate the buildup of inflammation first thing in the morning. So most people struggle with inflammation first thing in the morning, soreness first thing in the morning, and they find that as they get started, things get a little bit easier. Hello, Nomi from Pakistan. Awesome, on YouTube. Lovely. Thanks for joining. Hopefully those of you on YouTube are finding the camera angle okay as well. And if you've got any questions, guys, you can post them in the comments, wherever that is on the YouTube video as well. Back to TikTok, is that a posture chair? This is a hag chair. This is quite cool if you're like winding around. They're a little bit expensive, to be completely honest, for what they are, but they are good, right? I find this is quite good for a number of reasons, and I'll explain why if you've got a lower back injury. Number one, it's got a saddle on it, so you guys can see the saddle here. And by the way, I'm not affiliated with these guys. If you want to go and Google them afterwards, go ahead, right? But yeah, I just use it because it's a good chair and it's cool and it's a bit quirky as well. And it's very comfortable to move around on, if that makes sense. And you'll see why in a second as I go through this. So number one, the good thing about it's got a saddle. So I can have my thighs going off like so. The reason sitting is problematic is because when my knees are up like so, it rounds my lower back. It puts strain on the lumbar spine. So having the saddle, whether it's this or any other kind of saddle, it can really help because your thighs go off, which helps you keep a more neutral position in the seated position. The next thing I find it quite comfortable is if you sit back, it rocks back a little bit. And if you pop your feet up like so, this is relatively comfortable. And with my arms on the rests here, I get a bit of decompression and unloading of my lumbar spine. So this is quite a comfortable position to sit in. Obviously, some of you guys might not be able to do that with your legs, but even just sitting and rocking back like so is actually quite nice on the spring mechanism. Now more of my weight is going through the chair. The other comfortable option with this one, which is quite good, is like so. This is actually really comfy. So you sit and lean like this. It's easier if I lock the chair so it doesn't move, but this takes a lot of pressure off. So you can imagine, as I'm doing some typing like so, it's actually pretty cool. I can set my spine nice and neutral, and you've got weight coming through the chest pad instead. A very comfortable position. They're like 400, 500 pounds for this, and they're like 1,500 pounds for just an upholstered version. It's exactly the same. So I think they are a bit much, but hey, if you like them, and a lot of the members in the program do find them, the ones that have tried these do find them quite good. So if you like it, it's worth having a look at. What are the comments? We've got a comment here on YouTube. After how much time of doing strengthening exercises should I start lifting weights in the gym? I do the core 5 exercises. If you're doing the core 5 exercises, so that's the dead bug, the marching bridge, squats, hip hinge, and step up, they should just progress over time. And this is one of the important things that a lot of you guys don't quite understand or miss sometimes in the rehabilitation that you're given. When XYZ physio or osteo or chiro gives you this sheet of exercises and said, do these exercises for your back pain, it needs to change and evolve over time. So the core 5 exercises, one of the great things about them, especially 3 of them, the squat, the hip hinge, and step up, is that you only have to learn them once. You only have to understand them once. You only have to understand how you fail at them once, or during, over a couple of days or whatever it may be. Master them once, because then you just keep using the same exercise over and over. But the way in which you are doing rehabilitation needs to change over time. Meaning, if you're doing 10 squats and there's no trouble with that, you need to do 10 squats with load. You need to figure out what load that is and what's an appropriate amount of load. We talk about this with members in the program, and we help them in parts of the discovery workouts where we're literally picking a bunch of different weights up and saying, right, we'll start doing 10 reps with 6 kilos on one session, right? And then, 10 reps of the squats, let's say, or 10 reps of the hip hinges, sorry. Okay, that was okay. Well, what about using 10 kilos? Can we do 10 kilos? Try and keep with the same piece of equipment. But okay, 10 kilos is okay. Okay, well maybe 12, 15 kilos. I test that out. Okay, what about 20 kilos? Because 12 was okay, or 15 was okay, or 18 was okay. So I do the hip. Oh, actually, do you know what? I can only do 5 of those before I have to put it down. Okay, well that's too much. So you have to figure out, we talk about this discovering the right level of load for you to use, using the same exercises, and that's how you scale the process of strengthening your lower back and improving your back health. It does take time, you have to be careful, but the best thing we can do is do these experiments. There is no time when we should start doing this. We have to do it based on how we're actually progressing with the rehabilitation process in the now. In order to do that effectively, you have to first validate that you can perform the exercises with their easiest version, with minimal, with no aggravation, and with correct choreographic technique. That's the body weight squat. That's the half rep hip hinge. That's the half rep dead bug, those kind of things, right? You validate that you can perform the exercise correctly where there aren't high stakes, right, with lots of load. And then once we've done that, we can then start to explore what's the right kind of weight to actually make my strengthening effective. right? Because you're not changing. If you're doing 10 reps of squats for the next 6 months and you do 3 sets, 4 sets, or 5 sets, you are not going to change. Yes, you will benefit from technical competence improving over time, but you're going to hit a threshold of that, a ceiling of that benefit reasonably quickly. Remember, the purpose of our rehabilitation, which kind of ties back into what I said at the start of this live session today, the purpose of your rehabilitation, the way in which it works, is the following. Firstly, when we are performing our exercises, our spine stability exercises, we are providing more protection for the lumbar spine. We are learning to recruit our midsection correctly so that when I'm getting out of chairs, I can do it with a neutral spine, reducing unnecessary aggravations and flare-ups that happen from a day in, day out process. In the medium term, I'm taking those exact same exercises and I am leveraging the difficulty of them. So I'm starting to actually challenge my muscular system as well as the spine to a degree. But in that medium term, the muscles will actually get stronger. So the muscles of this midsection are more able to protect and guard my lower back from stress and strain of daily life when I'm picking up my toddler, when I'm carrying shopping, when I'm having to do the many things that I have to do every day, so that healing can continue to take place with less and less interruption and unnecessary flare-ups. In the long term, the way in which your rehabilitation works, the exact same exercises done over a period of time and done progressively, is that we start putting load back through these injured sections of the spine. And those start to change as well. Your muscles will change over a period of weeks when we expose them to the right kind of strain, significant enough strain. Your ligaments and your discs, on the other hand, will change over a period of months. So it takes time. The expectation that I'm going to do my exercises this afternoon and I should feel better afterwards is false, is flawed. Now, while you might actually find that you really do find them relieving in the moment, that's an extra bonus. But you have to understand the way in which rehabilitation works to help you. And it is a transformative thing. Too many people are looking online for like some special little gimmicky stretch that they can do. Like if I walked into the clinic or into the hospital with a broken leg and had a treatment or whatever it may be, I wouldn't leave the hospital and go, my leg's been fixed. It's like, but for some reason with back injuries, the expectation is I can do a stretch and the injury just goes away. Because so often we're dealing with chronic back pain, we're dealing with chronic back pain, we're dealing with acute sciatica, we're dealing with long-standing sciatica. We're not talking about it in the correct way, that it is a back injury that I keep on messing up. And so I have an injury at the root cause of these problems, as we discussed on the live the other day. And so it takes time for me to actually support that healing process. And the biggest needle mover in the short term is actually you stopping yourself from aggravating your back every day because you're not aware of how you're moving. So going over back onto TikTok for some more questions, and thanks Nomi for the kind comment. Thank you so much, you changed my life. That's awesome. It's nice to know this is having an impact for you guys. So should we keep doing the exercises during a flare-up? So Miranda's asked here on TikTok, should we keep doing the exercises during a flare-up? And if the proviso or the assumption is that you're actually doing the correct exercise, you're doing spine stability based exercises, right? As is distinct from knee hugs or child's pose or something like that, that wouldn't make sense. And the answer here is yes, but you might need to dial them down. So if, for example, you were in a more progressive stage of the rehabilitation, say you were what we would call phase 4 in the program, in the Back in Shape program. And by the way, if any of you guys want to learn more about the program, you can check out the link in the profile page, or I'll post a link in the YouTube video, or there'll be a description afterwards, backinshapeprogram.com/start. If you're further on in the rehabilitation program, and maybe you're using like 20, 30 kilos on your squats and hip hinges, but you did too much or something happened, right? You might dial back and do shadowed reps. So shadowed reps would be reps with no weight, or maybe you would go from using 20 kilos on your squat to like 5 to 10 just to test the waters. But actually using those periods of time when we do have a flare-up to test the movements with lesser weight in that stage of recovery can actually be quite enlightening. Because unfortunately, some people will go through the recovery process when they're recovering from back pain and they're doing the rehab exercises, but they're not really doing them as well as they otherwise should be. And they've been a little bit lax with the technique. And they have been rounding their lower back a little bit when they've been doing the squats. And they have been not controlling themselves quite as well when they're doing the dead bugs, etc. And so now we're extra sensitive. We're aware of how we are messing things up. We're aware that we're not actually stabilizing that core quite as well as we thought we were. And so while we're in this state of having a flare-up and we try the dead bug, we realize that if we do it like this, we cannot have aggravation during the rep. But if we do it like we were doing it before, we get aggravation. And some of that, or a lot of that, is just that extra sensitivity that's just reminding you, actually, do you know what, you need to dial that technique in. So So there's that scenario. In the other scenario, where you're very early on in the rehabilitation process, for a lot of people, you're having flare-ups every single day anyway. You're doing a ton of stuff every single day anyway. If you're still messing around with body weight reps, if you're still doing squats like that, that's your pain-free squat, yet you're having to sit on the toilet seat on a daily basis, which is normal part of human life. You're having to get out of bed on a daily basis. You're regularly using or doing squats that are below your level of competence. And so you may as well carry on with the rehab work anyway, because you're already doing every single day thing in spite of the flare-up. This is the big point, right? This is why these specific exercises are chosen. Because in spite of the pain, you're already getting the toddler dressed to go to nursery. You're already getting yourself dressed. You're already going to the bathroom. You're already maybe straining on the toilet. You're already going down the stairs. You're already getting out of bed, doing all of those things anyway, in spite of the flare-up. So you may as well do something each day that might have the cumulative benefit of getting you better. And you'll find that you get out of the flare-up faster as a result as well, because you become technically more proficient relatively quickly or faster. Your technical improvement on the rehabilitation exercises, if they are the right sort of ones, like we've discussed, will happen relatively quickly. And that has a huge effect if you mentally apply that skill to daily life, which is why education is so important. Of the Back in Shape program that we have, a significant majority of the information is actually educational. It's not exercises. Yes, there is a heavy component of the actual program that is the doing of the exercises, but there is a much larger component of the program that is about education, helping you guys understand this thing, helping you guys apply what you're learning in the rehab to your daily life so that you can stop messing yourself up. Because the expectation that 20 minutes, half an hour, maybe even an hour a day of some kind of rehabilitation is going to offset all of the abuse that happens every single day in subtle ways, it's not going to work. You have to address that other stuff. There's 16, 18 hours of the waking day that you're probably going to be doing things that could be done in a more back-friendly way. And so making those changes can have dramatic, often very quick effects for the better in even those that have had back pain for years to decades. Like, it can be so dramatic, the change. And that's just from technique. You haven't even done much healing in that scenario. You've just stopped aggravating it. Someone said, I'm really struggling at the minute. I have an L5, this is C therapy Cornwall. You've got an L5S1 issue and it's affecting the foot. It's seriously painful. So one of the things that a lot of you guys are going to leverage in the early stages of recovery is relief-based practices. Relief-based practices are very distinctive from the rehabilitation and strengthening work. Strengthening work is the stuff I've been discussing for most of this podcast, or most of this live session, sorry. The relief-based work is stuff like the towel decompression. The towel decompression is where we take a small rolled up towel, around about this large, we place it underneath the lower back. That supports the natural lordosis. It takes pressure off the lumbar spine. It decompresses the spine here. It also takes pressure off the ligaments and the muscles on the back. That's one of the stretches that you can do. You can do something called the bed decompression. There are examples of this on the YouTube channel and on the website that demonstrate these exercises and stretches, so you can go and check those out after this. Just go up to if you're on TikTok, just up here. And if you're on YouTube, then you guys can check it out on the rest of the YouTube channel or the website. And those kind of relief-based practices. Contrast bathing, right? A lot of times the injury that we've got, this herniated disc that we've got at L5S1 down here, right? There's a lot of inflammation around the herniated disc in this space. And so using contrast bathing directly over the back can really help manage the excess inflammation that's around that herniated disc and help calm it down a little bit more swiftly. Little bits of aggravation-free walking can help with little bits of movement. Again, draining the excess inflammation. If you've just had this significant event, we've aggravated the herniated disc, maybe it's a long-standing one, or we've had a significant trauma, we've moved funny and we've flared it up for the first time, there's going to be a lot of inflammation around the lower back. So managing that excess inflammation down here with contrast bathing on top of the other things I've mentioned can be really helpful. Mobilizing the hips can be really helpful as well. Like doing some simplistic hamstring stretching to keep these areas more mobile is really helpful, because if I have very stiff hips, right, and my hamstrings, for example, are stiff, which they very commonly are. If you've got an L5S1 disc injury, it's going to send signals down to the hamstrings to tell them to tighten up. And if my hamstrings won't flex anymore, I have to get my lower back to work, right? And that's not good for the lower back injury. So doing some element of hamstring stretching to stretch those hamstrings out is helpful, but it needs to be done with the neutral spine. You don't do hamstring stretching like this, where I'm rounding my lower back. That's not even effective hamstring stretching. It's just rounding the lower back. But those relief-based strategies, you can do them multiple times a day. Understand that they are not cumulative, meaning you do not get any cumulative benefit for doing them. They will provide you temporary relief for strain that is building up on the lower back. You must make progress on the strengthening front, and you must start to understand how you're messing things up on a daily basis. And for those of you watching, there is a back pain relief routine that's on the TikTok page, on the playlist section. There is an example of this on the YouTube channel as well in a playlist section, all publicly available, guys. You can check that stuff out. And of course, if you need more help and structure with these kind of things, then you just go over to the website, backinshapeprogram.com, and check out the program. Like, there's a video on the page /start, which is linked in the profile page, and it just explains a little bit more about how the program can help you. So guys, those of you that are on YouTube, just because I haven't mentioned it in a while, if you've got any questions, any comments, you can post them down in the comment section. You'll probably see that's live in the chat. And those of you on TikTok, keep them coming in, because I've got to catch up with some of these. So when I lie completely flat on the floor, I feel my lower back straining. There's generally, the main reason for this is often that as you lie back flat on the floor, so you're flat like so, if we've got any tightness in the hip flexors, it pulls the back into an arched position, and that strains or closes the hole around where the nerves come out here in the lower back. You guys can't see on YouTube. These little holes here, as we arch backwards, it creates a little bit of extension in the lumbar spine as you lie with your legs flat. And that's because there's inflammation down there, there's maybe a bit of disc herniation, etc. So you're better off trying to lie on your side for the time being. We've got a comment here by user 120. I've been using, I've been using an inversion table, and it's really helpful. It's taken the pain away from my leg. So inversion tables are great options for you guys to have at home. There are 3 things that we really recommend you guys have if you're trying to recover from back pain as really worthwhile, high impact investments. Number 1 is going to be something like a massage gun. This is the cheapest model from Therabody. They do the job right. And you can get massage guns for under £100 nowadays off Amazon, $100 on Amazon. Number 2 is that ThermCube that they make, which does contrast bathing. I don't have it here because it's at home, but that's a very good option as well. And then the 3rd one is the inversion tables. Why? We've got the towel decompression that we talk about for relieving back pain, relieving back strain on those herniated discs, particularly L4-5 and L5-S1. We've got the bed decompression, another mechanism to try and do this at home, to take pressure off these sections down here where we have the herniations. We also, obviously in the clinic, in the big wall behind me, do spinal decompression on the IDD tables, a very big machine that decompresses the lumbar spine. It's fantastic. But the at-home version, the inversion tables, can be really helpful tools to provide an element of unloading to that lumbar spine on a daily basis. You've got it in the living room, you've got it in the garage, it's set up there all the time. You can use it regularly. We actually, for those of you that do have these, we have a tutorial on how to use them. It's publicly available on the YouTube channel, on the website. And if you guys want a link to that particular episode or episode of the podcast or tutorial, then just send us a DM or comment in the comment section below, and we'll send it to you. Or you can find it on the website as well. Just type in inversion table tutorial. But using it correctly is really helpful. But you have to understand that the inversion table is a relief-based practice. So you have to pair it with proper strengthening rehabilitation. Otherwise, we're providing relief, but not providing the impetus necessary to help these herniated discs actually go through the healing and strengthening process. That is what gets you better. Too many people go through these periods where they actually maybe do a reasonable job of managing the inflammation and calming it down, but then they find they're having one flare-up every couple of months, every 6 months, every month, every fortnight, whatever it may be, because we're actually never going through the strengthening process. And so I liken this to the child that falls over and they bang their knee and they've got a graze on it. And you can see it's bleeding, there's blood all going down the shin. And then after a few days, there's just a scab there. It's not painful anymore, but it quite clearly hasn't healed. And too many people have a quite clearly hasn't healed lower back that they then go and re-injure because they don't do the rehabilitation work to guide the strengthening process of the tissues. Owen has said on YouTube, if after an exercise I feel more pain, what should I do? Should I continue or reduce the intensity? It entirely depends on the circumstances around that exercise. Is it immediately after? So for example, we want to assume that we're doing the right sort of exercises. We're doing spine stability based exercises like the squat, like the hip hinge. So if we're coming over here and we're doing, I don't know, a squat for the first time with a 20 kilos, right? We've done that. We had no pain during the exercise. If you had any pain during the exercise, that's awesome. That's absolutely fantastic. Drill into precisely where and when in the movement, not in your back, but in the movement, did you experience the aggravation? Did you experience the pain? Because that will tell you where you're going wrong. And it's best to fail in the exercises because you can review yourself. You should be taking videos of yourself, especially if you're going through a tentative rehabilitation process, if you're trying something new for the first time. right? To look at precisely where did things go wrong, when did you feel the pain, review the video that you took of yourself while you're doing that, and if you didn't do that, take videos of yourself, especially if you're early on in the recovery process or trying a new weight or something like that. But all too often, people will find that actually, oh, well, I felt a little bit sore later on in the afternoon or a couple of hours afterwards or something like that. Also, when they're early on in the recovery process. So if you're early on and you're actually just using bodyweight squats, for example, and you tried them, and then later on in the afternoon, you're a little bit sore, or a couple of hours later, or even 15, 20 minutes later, you're a bit sore, think honestly about what were you doing in that time afterwards, right? So for example, if I do 10 reps of squats like this, if that's competent, right, I got no pain there, and then I went over to the coffee shop, or going into the living room, sit down on the thing, just go on my phone. Oh, is it any wonder my back is now sore, right? I've established that I could only squat competently to here, and now I've gone and sat down chilling out in the afternoon. Like, is it any wonder that I've become sore afterwards? People don't think about those things. What else precisely are we doing specifically? And how does that compare to the stress and strain of our exercises in the moment? All of these kind of things need to be considered. This is one of the big reasons why. It's not overly complicated, but it does need to be effectively troubleshot so we can get intelligible information to move forwards. Maybe we do actually need to reevaluate. Maybe it was maybe it was too much weight, the wrong loading on that exercise. Of course, if we're doing the wrong sort of exercises, well, then that's a different kind of thing altogether, right? But it's worth bearing that in mind. And this is one of the reasons why we have the membership area alongside the actual program, because everybody's going to go through the program, even with the same diagnosis, and have different struggles along the way. People think that you need a specific program for your diagnosis and that you need something different if you've got an L5-S1 herniation compared to if someone else has got an L4-5 disc issue with whatever it may be, right? You don't. But everybody does have a different process as they go through. And so John, who's got an L5-S1 herniation on the left-hand side, might really struggle with his ability to execute the squat. Whereas Sarah, who's got the same diagnosis, might well really struggle with loading the weight. She's actually fine when she's doing body weight, but when she gets past 20 kilos, she really struggles. Someone else entirely might well find that they really struggle when they are getting to the point of just lying on the floor to do the dead bug, but you've all got the same issues. So granted, if you've got a lower back issue, you do need a specific program. It's no good you doing a shoulder program. You need to do a lower back program. But if you've got a lower back injury, the uniqueness of how you progress through that process is in the challenges you have in trying to rebuild spinal strength, not in a specific set of exercises. You need different ones for your back. No, that's not how it works. And so that's very important to bear in mind. And because of that, as everybody goes through that recovery process, they have questions that crop up along the way. And having a guiding hand as you're going through that can make all the difference in making sure that the process is a smoother one. We've had a question on here. Inactive Beast FC 123 has asked, I don't have any herniated or bulging discs, but I have had lower back pain for 3 years. Lower back gets very tight when standing for 10 minutes, and I feel the need to sit down and bend over to relieve the tightness. It might well be worth you getting a bit of a better understanding of what exactly is going on, considering why we say we don't have any herniated or bulging discs. One thing that's helpful for you guys to understand or appreciate is probably the worst case of back pain that I ever seen. That really surprised me. And that was very early on in my career when a guy walked into the clinic with a bit of backache that had been going on for a number of years. And he'd never bothered having any scans or imaging. And he just walked into the clinic, said, hey, you're doing some x-rays. I see with a special offer, you can have a look at my back. It's been bothering me for a long time. He was in some sort of manual trade. I forget exactly what he did, but it was a manual trade. So he's lifting and doing stuff and has been doing over the years. And he's just been battling this back pain. So it turns out he had what's called a grade 4 spondylolisthesis. That means that his L5 was basically his whole spine was off the front of his sacrum. Grade 4, for those of you that don't know, the spondylolisthesis are graded when the vertebra slides forwards like so. 4 is basically 75 to 100%. And it was basically sat on the front like it was going to fall off, right? It had evidently been there for a long period of time. He had some minor backache, okay? I contrast that with other members that I've seen in the program and patients I've seen over the years, and we do images, and there's nothing really that significant. Yes, there is some degenerative change. Yes, there are some things that we can talk about, right? But we wouldn't classify them having significantly bulging or herniated discs. And they're in excruciating pain. Just because we don't have any formalized significant herniated discs, we've had an MRI, we've had some imaging, we say, oh, well, there's nothing really that bad, but there is still something there. And we can have minor strains to these things and unfortunately have more significant symptoms. And so we go on the proviso, as in this particular case, we have a back injury. It's probably involving the lumbar spinal segment at L4-5 and L5-S1, most likely. And when we do certain things like sitting for extended periods, etc., then we start to get some pain. When we bend over, we round our lower back, we hug our knees, it often feels nice. Why? Because there's inflammation, because there's an injury there at this level down here in the lumbar spine. And when we bend forwards, we open out and create more space. That's why that feels relieving, right? But we're making the problem worse. So it might not be substantially herniated or bulging, but all too often you'll get the report back and they'll say like, oh, there's nothing really significant there. It's just normal wear and tear. Like, no, that is significant. Someone can be struggling with back pain for 3, 4, 5, 6 months, 7 months, 10 years, whatever, with more minor, to speak of, degenerative changes in their lower back. And so basically everything that we're talking about here on the live is relevant. Do the back rehabilitation work, do the strengthening work, start to be more conscientious about how we're moving and using our body on a daily basis, and we'll start to find we get better as the spine falls over. So hopefully that helps, makes a bit of sense there. Thanks for the question. What other question? We've got a couple coming in on TikTok. Hi, Michael. I've got a Roman chair. As I was told, it's good for disc recovery. Dominic, we've started recording these. That's why I've got the YouTube up as well. And we're posting the video on the YouTube channel so you guys can go back and watch bits because I appreciate many of you guys jump in, and I've already been going for like 41 minutes in this particular episode of the live. I spoke a little bit about the Roman chair, about the back extensions, and fundamentally, I think like you can. There are many people that use them, and you'll probably seen the channels on YouTube and on TikTok of people using them. All it is a hip hinge with unnecessary layers of extra complexity. You know what it's like, right? You have to mess around with that pad to get it in the right spot. If you put it too high, you're going to be bending your lower back. If you put it too low, it's not quite comfortable. You've got to get it so that your knees aren't uncomfortable between there and so on and so forth, right? I'm making it out maybe to be a bit worse than it is, but it's not like just sitting down on a chair, right? You've got to lock yourself in place so you don't just topple over and the whole thing fall over, right? It's unnecessary. You're basically learning to do a hip hinge. Just do it on the floor, right? It's much, much safer for you to practice doing your hip hinge here to rebuild from your lower back, from your bad lower back, right? All the Roman chair is doing a hip hinge. Yes, you can do a hip hinge badly and you can round your lower back, and you'll see stuff online about people doing the Roman chair with a rounded lower back and saying all this kind of stuff about it. But fundamentally, if you're doing it correctly, it's just a hip hinge. Or if you do that hold for like 2 minutes or whatever it is, you're just holding a hip hinge. You could also just do this correctly. That is a hip hinge. Chopping vegetables, right? It's exactly the same thing. You've just had to have the convenience or the privilege of spending an extra bit of money on buying a piece of gear. The important criticism I have for it is that when people are early on in the recovery process, you might be failing, you might be aggravating yourself, you might move a little bit funny, and it's hard to bail out of that machine. Whereas if you're doing it in front of a chair and you go too far, you can easily catch yourself on the chair and get out of position. And so we want to remove the barriers to people being able to execute these kind of exercises in their back rehab, not create unnecessary ones. And that's unfortunately what I think that chair does. It just creates an unnecessary thing you need to buy that's kind of a waste of money, I would suggest. Because there's nothing you can't do on the Roman chair that you can't do on a hip hinge, a regular hip hinge, like we teach them all the time. You don't need any specialist equipment. Sure, you're going to need weights sooner or later, but you need that for both of them, right? It's just an unnecessary expense, in my opinion, and adds unnecessary complexities. What other questions have we got here? I've had 2 herniations at L4, L5. L4, L5 and L5-S1, Richard has. I've had a lot of hip trouble with this. Now I'm very active, riding 3 to 4 horses a day. That's quite a bit. I still get bad back whenever I sit without support or drive for an hour. So what it looks like Richard is doing there, and thank you for the question, Richard, is we've got an injury to the lower lumbar spine and we've got a busy, active life, which is awesome. And we're doing some cool stuff. But we haven't devoted the time necessary to do the appropriate levels of rehabilitation and strengthening work. And this happens all too often. Especially if we're an active person, we can probably manage to get our back to a certain level, but unless we do the rehabilitation work, we're not actually rebuilding strength and integrity of those discs, those spinal segments, to actually rebuild the strength of them and reintegrate them into our spine. And so we are kind of just in this middle of the road kind of area where we're kind of okay to do a little bit of stuff, but certain things kind of bother us and aggravate our back because we haven't built that strength back into it again. And it gets bothered if we sit for a too long a period of time and those kind of things. The real important question for someone like Richard is what do you hip hinge? What do you squat? These are the best metrics for knowing how strong and how far through the recovery process your back is. And that's why we choose them as essential exercises, because they are the thing that give you that gauge of how healed have we become, how much strength and stability have we rehabilitated into that lumbar spine. And all too often, a really good video for you guys to watch is the back recovery journey. If you're watching on TikTok, you can send us a DM for this. I might even be able to do this in a really, really good way on here. Bear with me, guys. As soon as this is live, I can just do this, which is quite cool. I'm going to paste this in the chat. Watch that video, because too often people fall into this middle of the road recovery trap when they're recovering from back pain. And they get to a point where their symptoms come down and they've made a bit of progress on the rehab front. And then they're like, my back's not bothering me as much. I'll go and do all the other stuff I was doing before, ride the horses 4 times a day, all that other kind of stuff. And the rehab work doesn't get done. The rehab kind of stays not quite there. And so now there's a disparity. I'm like, sometimes this results in a flare-up. Often it results in a flare-up. In Richard's case, it's just that he hasn't progressed. We have to focus on actually building objective resilience back into the lumbar spine, and your strengthening exercises are the safest way for you to do that and the most predictable way for you to do that. Awesome. Thanks for this advice. This has given me confidence in my current physiotherapist. Awesome. That means that they're probably doing the right kind of stuff, which is cool. What I would say here is I had great exercise with physios prior, but seem to have found a good physio I'm working with, fingers crossed. The previous physio just gave me banded crab walks. Yeah, guys, if you've got lower back pain and you've been giving banded crab walks and clamshells and do some Supermans on the floor, that's not rehab, right? You're not building strength and integrity. You have to ask the question, where is this going? How are we going to demonstrate that my back is stronger and healthier than it is? And like, it's such an easy answer, right? It's like, hey, John or Richard, you've got a really bad back. You can't even squat or hip hinge. Would you like to pick up this 36 kilo kettlebell? No, of course not, Michael. That would be stupid and I'd be in a lot of trouble. Great. Okay, well, what we're going to do is we're going to start with body weight. And then over the course of the weeks and months, we're going to go through these layers of dumbbells and steadily build up, always observing aggravation-free reps with correct choreography. And then over the course of time, you will be able to say, I could only pick up 5 kilos and do a squat with it because 7.5 kilos aggravated my lower back. It gave me symptoms. It irritated my herniated discs. But now I can happily pick up the 36 kilo kettlebell, 80 pounds, and do a nice little squat with it without any trouble. I can do 10 reps of that. I know for a fact my spine has increased in its resilience because I can demonstrate that in a way that's reasonably logical. As opposed to, I've been doing this for the last 6 months. How do I know I'm stronger? Please explain to me how this is making my spine stronger. Like just going crab walks or the clamshells, right? I've been doing that. How is this making my back stronger? How is this building integrity in my spine? Ask your physio that. They will be able to, they'll struggle. They'll say, oh, well, it's strengthening your glutes. It's like, really? More than doing a squat and taking my squat from 5 to 36, 70 kilos? Like, it's not actually that complicated. So you just ask your guys, whenever you're going to see your physio, your chiro, your osteopath, your injection, your surgeon, whoever it is, ask them, how precisely is this intervention, therapy, treatment working to improve the recovery, the resilience, the strength? What is the mechanism by which it works within me to get me better? And that's an important question. Sometimes it's like, hey, John, it's just going to take away the pain for a little bit. That's it. The injury is still there. That might be the honest answer. So ask those questions. It puts them on the spot, and those then you understand that your physical therapist, your physiotherapist, your whoever, osteopath, if they're an osteopath like me, and then you will understand very quickly if they have thought about what they're doing or if they're just parroting out stuff that they don't really have an understanding of or haven't thought through themselves. Some more questions on YouTube. Hi, thanks for this streaming and all the content you provide. Appreciate that, Earthman. Just discovered a few days ago, my back pain is actually sciatica. It's been a catastrophe. 2 years it's been on my right. I got a new hernia on my left and my sciatica, and got my sciatica the same day. One of the things that you guys will all do better with is if you remove the symptoms from the equation. as soon as we know we've got an injury to the lumbar spine, we've got the L4-5 diagnosis of herniation, we've got something going on at L5-S1, you've got all the information you need. Now work on rebuilding strength and stability of that area, and you will notice that all the symptoms go. It sounds like it's a bit blunt, right? And it's like, hey, but surely there's something else. Like, surely it matters because my sciatica actually goes to my big toe, but 6 months ago it actually was only here or something like that, right? Providing you guys have the absence, you do not have emergency symptoms of cauda equina, saddle anesthesia, numbness in the area in contact with the saddle, bladder and bowel control loss. Providing we do not have those emergency symptoms, and you know you've got a back injury, the symptoms vary from one person to the next tremendously, and they're just a distraction. If we take away the statement of I have sciatica, no, you have a back injury that is causing pain in the leg. I have back pain on the left-hand side. No, you have a back injury that is giving you back pain. If we start to talk about it like that and we start to address the injury, we start to focus more on the cause, and we start to focus on rebuilding the cause, the health of our lower back, and then all of these different things get better. And I wouldn't speak so confidently about this if that's what we do, right? We've had through the program and through patients in the clinic, there isn't really a diagnosis that you can throw at us in the comments here that you might have that hasn't already been through the program or been a patient through our doors, right? There's only so many things that can go wrong in the lower back, right? There's only so many different things, but the symptoms can vary tremendously from one individual to the next, even within the individual. Oh, well, one day it was on my left-hand side and now it's on my right-hand side. And so it's important to not get distracted by the symptoms that we experience because they can vary tremendously with lower back pain, or lower back injury, sorry. My son has bad knees, what can help? Stacey, I'm sorry, we're really focused on lower backs here, but a great resource would be the knees over toes guy. Go and have a look at his stuff because that stuff's really good, and that's what I've been using. For those of you that have been following for a little while, you know I tore my lateral and medial meniscus last month, which is not very good, and I couldn't walk, couldn't get out of a chair. It was not a very good time, and that's the kind of stuff that I'm doing to fix that, and it's working well. I got an MRI like right after I'd finished the competition, and yeah, so we got all the objective measures, and that stuff works. Earthman has said, what have you said here? I think the operation from my left too. I think I got an operation from my left too. The process gave me some hope. The process that you provide on your channel, the Core 5. Yeah, guys, if you need more help with the Core 5, then do check out the program as well. We've got tons of free resources on the website, on the profile page. If you're on TikTok, on the YouTube channel, there are literally well over 1,000 videos on there to help you guys. And if you need more help, you can always check out the program on the website, backinshapeprogram.com. I have a bulging disc and spinal stenosis. What's the best thing to do? Lucy, if you have a bulging disc, it's almost guaranteed that you're going to have stenosis. For those of you that really get confused by these kind of concepts, and there are many of you, stenosis means a narrowing of a hole. So sometimes it will be said stenosis, sometimes it will say narrowing, right? We have one hole and two like other holes in our spine. We have the central canal. This is where the spinal cord runs through. Technically speaking, for most of you with your back injuries at L4-5 and L5-S1, it is not the spinal cord. It is the cauda equina. It is the collection of nerve roots because the spinal cord terminates around about L1, L2. You will commonly see on MRIs, the conus terminates at L1, L2. And you'll be like, what on earth does that mean? And they're just stating like you've got two arms, right? It's just a statement of that there is a spine here with a spinal cord that finishes at the usual place. You then have the exit foramina. These are the areas here and here, here and here on the side. These are where the spinal nerves come out, right? You can see it on the models here and here. You can see them all coming out the side, right? That's where they all come out. So there are really only those two areas, the central area of stenosis and then the sides. When you have a disc bulge, the disc should be within its boundary, okay? Not bulged. When the disc becomes bulged, it moves into one of those spaces. And therefore we can very clearly state that in this instance, the disc is bulging and the hole is smaller. Therefore, the hole is stenotic. So it's kind of par for the course. If you've got a disc bulge of some description, if you've got a disc herniation, you're going to have some degree of stenosis commented on somewhere. Now, it might be lateral recess stenosis, exit foramina stenosis. They might use slightly different terminologies depending on how far round this disc bulge is exactly. But that layer of detail matters basically zero for you as the person doing rehab. Once you know you've got the injury to the disc, which Lucy does, we start doing spine stability-based rehabilitation exercises to rebuild protection for that disc, start to learn how to move more effectively on a daily basis so we are not aggravating that disc time and time again. And then we start to build the intensity of that rehabilitation carefully, always observing aggravation-free repetitions to rebuild resilience of the lumbar spine over time and help that disc strengthen itself again effectively. And if you need more help with that, Lucy, check out the links in the profile page. Guys, we're getting to, I've been going for, 54 minutes on YouTube now, probably the same here. TikTok are very sneaky. They don't put the timer on there. So I just end up going live for too long. Like yesterday, the camera died because it ran out of battery because we were going for so long. So hopefully, guys, this is helpful. I'm going to keep going for a little bit longer until we get to the hour, and then we'll cut it off. If you guys need any more help, of course, there are many resources, and you can always reach out to us on the website. We'll check out the program as well. And make sure if you're on TikTok, you're following the page so you know when we're going live, and the same for you guys on YouTube as well. Just gonna have a look through here, guys. Get some comments in. YouTube, there is a little bit of a lag, so get any comments in now, and I'll just try and do the last couple. What else have we got here? It's John O'Bro. Thoughts on vax injuries and heart issues in young people. I'm gonna stay firmly in my lane. We do back pain. We do back pain. I got thoughts on that, but it's not our specialty. Marissa said, I'm having pain where my spinal fusion ends. Any suggestions? One of the big problems with these kind of injuries to the lower back, whether it's actually you've had a spinal fusion or you've just had a herniated disc, is that we often don't address the underlying causes of these issues. We don't address the movement patterns. So the person that's constantly rounding their lower back, bending in all sorts of manner of directions, is constantly aggravating that same section of the lumbar spine as they go through their day. They're getting out of chairs like this, and then they're getting, I'll go down here like this, and all this kind of stuff that is bending and straining the lower back and preventing it from recovering, which is why that segment had to have the surgery, because it was injured and you kept on re-injuring it. And so if we don't actually address these issues, then we're going to continue to struggle with that specific problem, because all that's going to happen is now you've had L4-5 or L5-S1 fused. Now L4-5 is just going to bear the brunt of that. And by the way, now you've got one less joint in the lower back sharing that strain. So it's even more focused. Physio Clark has said, hey mate, can I send you a message? Any of you guys can send us a message. Just send us a DM. You're more than welcome to. So Johnny has asked my favorite question ever. So what's the best exercise for a herniated disc? I really don't enjoy that question, right? There's not one exercise for a herniated disc, and it's done differently over time. But if I had to answer that, I'd say the squat. And it's a close choice between the squat and the hip hinge. The squat, for a number of reasons. Number one, even if you've just had spinal surgery, which some of you guys have had reasonably recently, you will be doing a squat from day one. You had to get out while you're in the hospital bed and go to the bathroom. And then when the surgeon came around and said, pat you on the back, said, hey, great, you can go home. How did you get out of the bed? You did a squat. All the way up to very recently, well, no, that was a deadlift. But in the competitive bodybuilding arena or powerlifting arena, people are squatting with hundreds, if not over 1,000 pounds of load. So this exercise is useful for the person that literally has just had surgery. They are doing a squat. And the person at the highest level of expressions of load tolerance in the powerlifting arena. And everywhere in between, the squat is done. The squat is done numerous times every single day and will be done from day one post-surgery. So it makes sense that practicing the ability to execute this exercise with a neutral spine and correct form is going to be really helpful. And if you learn it once well, then you can do it with holding onto your partner's hands once you've got home from the hospital to practice. You can do it steadily using a chair to make sure you're not going too low, right? And then you can do it using the weights, as I've already demonstrated on the live today. You can scale it to all levels. So it'd be one exercise to learn to really build load tolerance in your lumbar spine over time, to build the strength and stability of the core, the midsection of your leg muscles, and integrating a good movement into your daily life that has spillover benefits, not just in your exercises while you're doing them, but also through daily life, making daily life safer. So that would be my best exercise. And I'd probably say the hip hinge is a close second. The only thing it's missing is really that asymmetry, but you get that from a step up or something like that. Owen has said, how often can I do core exercises? So by core exercises, I'm assuming Owen is meaning the core 5. The core 5 is the mine's gone blank. Dead bug, marching bridge, squat, hip hinge, and step up. Those are the core 5 exercises. When you start out with your back pain rehab, you are going to perform those daily because you're having to learn how to do them. And chances are you're probably not going to be very good at them, and you're probably going to make a bit of aggravation, and you need to learn how to do them correctly, because the failure to be able to do them is part of the reason why you're not getting better. But once you've mastered that, you then start working out at a harder intensity. And then once you get past that point, you then start using the appropriate amount of load, etc., and you start challenging yourself, you will decrease the frequency of doing these workouts. You might well be working out 3, 4, 5 times a week, and then you'll bring that down to maybe 2 or 3 times a week of hard loading on the spine, because you need to actually recover effectively from these things. You need to give your body time to recover from a hard workout, right? And so the way in which we do our rehab changes as we go through the recovery process. This is why we break it down into phase 1, phase 2, phase 3, phase 4 in the program, because the same workout needs to be done, or the same types of workouts need to be done in different ways with exactly the same exercises in different ways, depending on where you are in that recovery process. And that's why just giving someone a sheet of exercises is not sufficient these days, or just going through them once in person in your clinical appointment is not sufficient. You need a more robust approach to actually get these things better. Awesome. That's the hour. Guys, I do hope that's been helpful. I've got other things to do today, unfortunately, and we've got to process all this and get all of the clips out and get it uploaded onto the various bits and pieces. I do hope it's been helpful for you guys. If you've got any other questions, you can always send us a DM, reach out to us on the website, backinshapeprogram.com. If you did find this helpful and you find these live sessions helpful, please, by all means, follow, like. If you're on TikTok or if you're on YouTube, you can always share this with other people as well if they would find it helpful also. We appreciate you guys joining in and appreciate all of you guys that have asked the questions. Sorry for those of you that I didn't get to answer the question specifically, but I do appreciate you guys, and I do sincerely hope it is helpful for you. Keep an eye out, because we'll be doing a couple more of these as we go forwards over the weeks. So make sure you're following, make sure you're subscribed, and we'll see you next time. Thanks, guys. We'll just close on TikTok. And Dylan, don't worry about messing around with kettlebells while you're doing dead bug. Focus on your squats instead. That'll be better. Awesome. Thanks, guys.